right, let's get back to the heart. So looking at how we use the veins and different pressures to get there, as well as circulatory shock. So with our blood, again, it's going to go down its pressure gradient and, that's one of the mechanisms, sorry. So with venous return, so there's different methods for it. One of them is pressure gradient, gravity, skeletal muscle pump, thoracic pump, and cardiac suction. So those are different mechanisms of venous return. So let's look at how each of these work. So for our pressure gradient, remembering that our blood pressure is highest as it leaves the heart, and then eventually it drops off as you go back towards the heart. So your blood pressure is helping your blood move so your blood's going to go down its pressure gradient. So from your arteries, through your capillary beds, and just continuous through your veins as it goes back to the heart. So that's where it has the lowest pressure is, right before you get to those larger blood vessels, right before you get to those larger veins where you're either almost at the heart or you are entering the heart. Another mechanism is gravity. So from the head and neck region, so basically stuff that's above the heart, gravity is going to help to drain blood from those areas. So this is the only external force that moves your blood back towards the heart. Next one is skeletal muscle pump. So as your muscles are moving, they're pressing up against the blood vessels, and so that helps to squeeze on those blood vessels and push the blood back towards the heart. Remembering there are valves on the inside of that endothelial layer that help to keep the blood as it's pushed through, and then keeping it staying in the above level. So here's a picture of it. So muscles move, they squeeze on the blood vessel. As the blood goes through those valves, then this blood is now going to stay in this upper area. So that valve just keeps it from moving back down into a lower section. So this blood will get squeezed and pushed into this upper section and then just stay there until it gets some version of moving back towards your heart. Next one is the thoracic, also called the respiratory pump. So when you inhale, that causes additional pressure in your abdomen, stomach region. So that's going to, again, just like your skeletal muscle pump, that's going to squeeze on your blood vessels and help to move fluid back towards the heart. And then the last one, I think, is your cardiac suction. Next one is cardiac suction. So as your atrial muscle relaxes, it increases the volume. That's going to decrease the pressure. And so the blood's going to go down its pressure gradient and into the atria. So this is going to be similar to how you see your respiratory system work with your movement of air, where you have an increase in volume will decrease the pressure. And so that allows for air to fill in your lungs. Or the opposite case, which you also can do this with thoracic pump, where, or similar to thoracic pump, where you squeeze on your abdomen area, or even squeezing with your chest muscles help to squeeze on your lungs. That causes increased pressure in the lungs. So increased pressure in the lungs because you have decreased the volume space, and so therefore air is going to move down its pressure gradient from your lungs into the outside environment. Oof. So one way to activate these different methods of returning blood back to the heart is using exercise. So increase in activity causes your heart to beat faster and harder. So there's more CO, which means cardiac output, so more blood flowing out the heart, and increased blood pressure at your arterial end. So that greater difference in blood pressure going to move your blood until blood moves even faster because of the greater pressure difference. Any vessels in your skeletal muscle areas, lung, and heart, they're going to dilate, causing an increase in flow, and that's going to just push blood through your circulatory system, so through all your veins, blood vessels, and that's just going to push more blood, again, going back to the heart. So as you're exercising, you're increasing your respiratory rate, so you're going to breathe more because your heart rate increase, your respiratory rate is going to increase. They're just tied with each other. And again, because as you're more active, you're going to need more oxygen. Same thing, so opposite effect when you're calmed down or resting or whatever. Heart rate and your respiratory rate is going to calm down because you don't need a bunch of oxygen because your muscles aren't doing anything. And you don't need your heart working that much because you're just sitting on your butt. Okay, so when you're exercising, though, because you're breathing more, you're going to increase your thoracic pump. So increasing your the pressure in your abdominal region because your lungs are expanding to fill with air. So they're pushing down on those organs and therefore squeezing on the blood vessels. And that helps to push blood back towards the heart. And then again, skeletal muscle pump because you're moving around. So those skeletal muscles are going to squeeze on the blood vessels, keep pushing blood back towards the heart. So if you are inactive, you end up having what's called venous pooling. So this is the same thing when you see some of those crime dramas and they have the dead body and they're like, oh, the blood pooled in this certain area. So we know that the body's been moved. And that's because when you don't have that heart pumping the blood anymore, the blood's going to pool based off of gravity. So it's going to just stay where it is. So there's no movement or anything that would cause the blood not to be in that area. So when you have venous pooling, that's because there's not enough force to push the blood up towards your head. Not head, towards your heart. One problem with that would be like prolonged standing. So if you're in a job where you stand a bunch and you're not moving around, which would help using that skeletal muscle pump. And so your cardiac output, so how much blood is coming out of your heart, will decrease and you may cause dizziness. So not enough blood flow to your brain. So by kind of moving around a little bit, that helps. Same thing with prolonged sitting. So if you're on an airplane, whenever we get back on airplanes, safely. But if you're on like a long flight, getting up ever so often helps. I know some people, and I've done this before, even wearing compression socks, and some people even take aspirin to help thin their blood to kind of make sure that they have good circulation. So speaking of good circulation, particularly if you are a jet pilot and you are, flying at a high elevation, they actually have specialized suits for them to help maintain good circulation, especially since they're in this tiny little cockpit. And so they can't really move around as much. Okay, so let's look at our different circuits of routes of blood moving through. So here's a nice, pretty picture. So pulmonary circuit, so dealing with our lungs. So blood vessels leaving the heart. So we have our pulmonary trunk to go to our left and right lungs. So this pulmonary trunk is going to split into a left pulmonary artery and a right pulmonary artery. Then we have our aorta that's going to send blood to the rest of the body. So those are two blood vessels that are moving blood away from the heart. Now getting to the heart, we have our superior and inferior vena cava. So it's taking it into that right atrium and coming back to the heart. Our left and right pulmonary veins taking our oxygenated blood from exchange in the lungs and back toward our left atria. So those are our major blood vessels in and out. So as you have your gas exchange, the capillary beds are around those air sacs called alveoli. So that's what we'll talk about in chapter 22. So we have our artery taking blood away from the heart, so it's deoxygenated, so that's what that blue color. Have our gas exchange is now oxygenated, moving on our vein Even though it is a vein, it's still colored red because it's oxygenated. But it's still a vein because it's going back towards the heart. So that's where you return with that oxygenated blood. Okay, so look at some other big blood vessels. So, oh, look, it's a star. So this dude, and other versions of this dude will be on your vessels exam, just kind of as a reference, because some people, as they're looking at their different blood flow areas, they might actually need to look at something in order to kind of trigger their memory on which blood vessel are they on the pathway. So you won't be labeling, it's more of a knowing the list, but having that visual reminder kind of helps. Okay, so 3 branches off of the aorta, and this is one of your labeling. So the brachiocephalic trunk, your left common carotid, and then your left subclavian. So remembering our brachiocephalic trunk, so vessel exam stuff, it splits into your right common carotid and right subclavian. So that's where they still have their same branching off to go through those same different areas. So with our aorta, and this is something you also have to know, our aorta starts off with 3 different sections. So we have our ascending aorta, because this goes up, our aortic arch. Kidding me. Okay, let's start this again, and I forgot where I was, so I'm going to have to start this over. Thank you to person who called me. Love you, mother. Okay, so for our branching around the aorta, so here's our heart. We have our aorta here, so it has its ascending aorta, so that goes up, so moving upward. Our aortic arch, so at the top part here. Our descending aorta, which also sometimes is labeled as our thoracic aorta. Then once that aorta passes through our diaphragm, there's a hole for it called the aortic hiatus. Once it passes through that, then it's called the abdominal aorta. So off the top of our aortic arch, we do have some branching. We have our brachiocephalic trunk on the right side. That branches off into the right common carotid going towards the head and the right subclavian going towards the arm. For the left side, there is no trunk. We just go ahead and split. So we have our left common carotid and our left subclavian artery. Let's see, branching off. Okay, so our aorta is our big blood vessel going away from the heart. So going into the heart, we have superior and inferior vena cava going into our right atrium. And then our pulmonary veins going into our left atrium over on this side. And this is a just chopped off portion of that pulmonary trunk going towards the lungs. And again, you do have your labeling, so of those 3 branches up top. So I'll kind of zoom in on just that section of the aorta. Okay, so the last portion of this PowerPoint, I believe, is nothing but our different blood vessels. So let's see what we actually need. Okay, so a lot of this I'm going to skip through. I know they have hearts on them for your vessels exam, but since, you're not labeling them, you're just knowing the pathway. So if you just want to know where in the body they're located and have them, pointed out, then you can actually look through the PowerPoint. So I'm actually going to skip through this because the last part of this, there's actually a little chart that goes with it. So I'm going to skip. Oops. No. Oh my God. What the heck? Okay. So before we had possession of my laptop, or more so the key got sticky, so I had to check that. So I'm going to skip through a bunch of these because for the study guide, it's just this one last section where I know there is a chart that goes with it. But again, a lot of these ones, because I do have a star on this, because they're on your, whatever that thing is, vessels exam. So for example, the circle of Willis, also called the cerebral arterial circle. So those are the same structures that you'll label, but that's all on the study guide for that exam, so it doesn't matter. But it's just showing you where they are in a realistic view of them. That dude will also be a reference on the exam too, or exam as well. Okay, so let me just keep going, because these are all just good pictures of these. Okay, yeah, that's still stuff that's on that test. Okay, so the last one for your study guide, know the arteries and veins involved the blood supply to the stomach, liver, kidneys, spleens, and intestines. So, of course, I made a table for that. I just got to find the table. There it is. Ding dong. There's your table. Oops. Dirty. Sorry. My bad. I know. Kind of messy. So knowing this table, so we have the top line is the organ, second one arteries to said organ, third one veins from said organ. So some of these are fairly easy. So we have our liver, common hepatic, so the hep portion referring to liver is the artery to, the vein away is also hepatic, so just the vein. Stomach, we get the splenic and the common hepatic. Gastric is the one coming out, so that vein. Kidneys, renal artery, renal vein, easy. Spleen, splenic artery, splenic vein, easy on that one. And intestines, we have our superior and inferior mesenteric arteries to and veins away. So those are pretty easy. It's pretty much the only ones you have to really kind of pay attention to is really the stomach, because the other ones, their organ name is in it. And so from these veins, from these large abdominal organs, it goes into your portal venous system. So this is how our liver is able to store up a lot of those nutrients that we have digested. It's because all that blood goes to the liver. So the liver can do its job. It also helps with our detoxing of stuff that we have, like, for example, drinking or medications taken. So that portal venous system is taking the blood to the liver, and then from the liver you use the inferior vena cava to get it to the back towards the heart. And that is it for this chapter. So this has more just labeling pictures, and that's just that portal venous system, but just another view of it. So just more blood vessels, and this is it for whatever this. There you go. It for this, what is this thing? This chapter. Okay. I need coffee. See you later.